the incidence of skin cancer is definitely on the rise. People are outside a lot more. Bathing suits are getting smaller. People are going to more extravagant locations closer to the equator where there's definitely a lot more intensity of sunburn and the risk for skin cancers. And the nice thing about coming to me as a plastic surgeon is that I'm very well versed in the different types of skin cancers. We can have basal cell, squamous cell, malignant melanoma, and some of the precancerous lesions that are very common. The other thing too is that by coming to a plastic surgeon, it's kind of like a one-stop shop. So if we find something that's suspicious, I can be the one that biopsies that skin lesion, and we'll send that off for pathology and make sure that it's not a skin cancer. And then secondarily, if we do discover a skin cancer, then as a plastic surgeon, I would be one of the best people to remove that for you, both with surgery and then also to close or reconstruct the wound that's created by removing that skin cancer. Try not to lay out in the sun just to get a suntan, especially during the hours of 11 in the morning and 2 o'clock in the afternoon. It's also important that you wear a large brimmed hat to protect your ears and your nose and your lips if you're going to be outside. Make sure you wear your sunscreen. You want to wear a sunscreen of 30 or better. And when you're starting to look at some of those sunscreens that have an SPF of like 80 and 90 and 99, they're going to be super expensive. So chances are, if something's super expensive, you're not going to use as much of it as you need. You might not even get it because you think you can't afford it or you can't find the right stuff. So 30 to 50 is probably a safe spot. As a general rule, something's better than nothing. Reapply when you're physically active. Make sure you get some sunscreen that's waterproof. And if you're going to be in and out of the water, make sure you reapply that every hour or so.